Do you have shoulder pain that just won't go away? Whether it's a dull ache at night or sharp pain when lifting your arm, shoulder pain can affect your daily life in surprising ways. In this video, we'll break down the common causes, how to identify red flags, and explore both simple and advanced treatment options. Let's dive in. The shoulder is one of the most mobile joints in your body, and that flexibility comes at a cost: instability. This complexity makes shoulder pain a common issue for people of all ages, from athletes to desk workers, from gym goers to grandparents. A proper diagnosis always starts with the history. Is there a recent injury or trauma? Is the pain sharp or dull? Does it worsen at night or when lifting? Is one shoulder visibly smaller or weaker than the other? Next comes the physical exam, checking range of motion, muscle bulk, and symmetry. Is the stiffness due to pain or actual restriction? This helps narrow down the cause. The rotator cuff is a group of 4 small muscles that stabilize your shoulder. Tears, especially of the supraspinatus tendon, are a major source of pain. Partial tears may heal with therapy, but complete tears often need surgery. Night pain and inability to lift your arm are red flags. Nearly 50% of shoulder pain visits are due to impingement. When you raise your arm, structures inside the shoulder get pinched, causing pain and inflammation. It's often linked to overuse, especially in athletes or manual workers. This is when the shoulder becomes stiff and painful due to thickened ligaments. More common in people aged 40 to 60, especially women, diabetics, or those with thyroid issues. The good news? Over 90% recover with non-surgical treatment, but it can take 18 to 24 months. The long head of the biceps travels through the front of the shoulder like a rope in a pulley. If irritated, it causes pain in the front shoulder and upper arm. Repetitive movements like throwing or lifting can aggravate it. The labrum is a ring of cartilage that deepens the shoulder socket. Slap tears occur at the top, like at 12 o'clock, often due to repetitive pulling. Bankart lesions, on the other hand, are more traumatic and often result from dislocations. Symptoms include deep pain, clicking, catching, and instability. The AC joint, where the collarbone meets the shoulder blade, can get inflamed due to arthritis, trauma, or heavy lifting. Weightlifters are especially at risk. Degenerative arthritis leads to global shoulder pain, stiffness, and reduced range of motion. It shows up clearly on X-rays. Not all shoulder pain comes from the shoulder. Cervical spine issues can refer pain to the shoulder region. That's why a good clinical exam is essential. X-rays are excellent for seeing bone issues like arthritis or fractures. But for soft tissues like tendons, labrum, and muscles, MRI, especially MRI arthrogram, is the gold standard. However, be cautious. Many people over 60 have rotator cuff tears on MRI with 0 symptoms. Most shoulder issues, even labral tears and tendonitis, can be managed conservatively. Key components include rest, ice, anti-inflammatory medications, and physiotherapy. Cortisone injections can help reduce inflammation for faster rehab. If pain persists despite conservative management, especially in complete tears or severe instability, surgical repair may be recommended. Arthroscopic procedures are now minimally invasive and highly effective. Warm up before activities. Strengthen rotator cuff and scapular muscles. Avoid poor posture, especially during long hours at the desk. Seek help early if night pain or weakness sets in. Shoulder pain is common, but it doesn't have to control your life. With the right diagnosis and approach, most people recover fully. If this video helped you, don't forget to like, share, and subscribe to Global Wellbeing for more science-backed health content.